Hello, I'm Brian,
And I'm Deb.
and we want to welcome you to Life in
Guatemala.
Guatemala. Today, we're going to talk a little bit about our health experiences down here. Not necessarily health, but
Our health
medical, healthcare. In a prior video on budgeting, we mentioned about insurances and stuff. So we're going to go into a little bit more detail about that and what we've done and what our experience has been here.
And we're going to cover three main areas, and we're going to try to keep this somewhat in sections for you. First, we've discovered an ambulance service that works as almost a type of healthcare. We're going to talk about pharmacies down here and what our experience has been in obtaining medication. And then we're going to talk about our experience with doctors in general and even stays in the hospital.
And a little bit about the insurance that we have.
Yeah, and our costs and what we pay for these things. And what we're hoping is this will help you make informed decisions if you're trying to decide whether or not you should pay for insurance, chance it without, or, to come down here or not come down here. I mean, there's a lot of things you might have to decide.
Let's start with the ambulance thing. So when we first came down here, we didn't have anything. I retired from my job in the USA, and with that retirement, I did not continue my health insurance. So we came down here without any health insurance. In the first 2 years, 3 years down here, we didn't have anything. And, we did, Debbie had to go to the hospital one time. When we did get sick with various things and we had to get medicines and whatnot, but
it was at the bank that we first heard about this.
When we went to the bank and we saw this brochure for this ambulance service, and it's what we have is called Alerta Medica. You pay a yearly fee,
and you can pay it monthly, but we choose to pay it annually.
Yeah, it's a yearly coverage, and the rate that you pay is based on the number of people that you're covering in your house. So initially we were paying for 3 people, and it was extremely reasonably priced. I don't even know what the cost was.
Well, we just paid last month for 6 in the house, 5 in the house we paid for, because Delia has coverage.
Yep.
We paid for 5 in the house just last week, not last month. And I paid what would come out to the equivalent of $25 a month for the service.
For 5 people. So when we started for 3 people, it was even less than that. What it does for you is it gives you 14 covered calls
to your home annually
per year. Plus they have free telemedicine if you need it, where you can make a phone call, or I think they also said like a FaceTime type of call or something, like a video chat. But I think they said those were unlimited.
Yep, and you can do that. But it's all in Spanish, of course.
Yeah, but the good thing about them, it's almost like going to
emergency clinic.
Yeah, a little emergency clinic, or having a house call from your doctor. When you call them up and they come to your house, every ambulance contains or has a doctor
and a
paramedic on it.
It's like a mini ER showing up at your house, regardless of what the call is. In the United States, depending on where you live, you could have 2 EMTs or an EMT and a paramedic. And I don't know of any, they may exist, where a doctor shows up at your house on an ambulance for just a general call. It doesn't have to be an emergency.
Yep. And so the things we've used it for, a couple of times we've had some of the young ladies that are staying with us, they got sick, and so we called them up and they came and they either got a shot or they got an exam and maybe some kind of prescription type of thing. Debbie has had his stitches 2 times.
And they do it right here in the house.
Yeah, and we called them up, they came and they stitched her up and left. And then when it was time, at least one time, to get the stitches out, didn't they come back? Or
no, I took them out.
Even out of your eye?
Yeah, I took them out.
Okay, so
the point is, it's covered. We didn't pay extra. That's part of what's included in the cost. It's like having a doctor call, like Brian said, right to your house. And if you need it more than 14 times a year, you probably need something more than ambulance service.
Yeah. So that's the first thing that we did.
That was our entrance, if you will, into insurance.
Yeah, well, and let's talk about the insurance that we have right now, both in the United States and here in Guatemala, because like I said, we had insurance when I was working in the USA. When I retired, we didn't continue that insurance, and at some point when we came down here, because right now we're both 60 plus years old. Well, we were 55, 57, 58 years old. We decided we needed health insurance in the United States. So 2 different times we signed up for
it's the Affordable Care Act. Yeah.
Something in the Affordable Care Act. And then when we went back to the States, we got some exams, treatments, whatever it was that we were looking for. Just this past
December.
Yeah, it was almost 1 year ago, and I was having some medical issues with a kidney stone, and we paid a lot of money out of pocket. And after that, I had this feeling that, you know what, we should check into health insurance here in Guatemala. And we did check into it before. As a matter of fact, when we were first going to move down here, we checked into global health insurance, because that's a lot of concern of people.
Right, yeah.
Is what are you going to do if something happens? You can be financially ruined if something bad happens and you don't have insurance. So we looked into it, and it was super expensive.
I was finding policies at the cheapest, maybe $400 a month. That's almost our rent. At the time, it was our rent when we first moved down here, and up on that. And it's like like Brian had said previously, we moved down here to save money, not to spend more money. And then another issue that I've heard some people have with that kind of policy is you may still have to pay out of pocket here and then submit everything for reimbursement, because a lot of places here are not going to accept anything other than local insurance.
Right. So just specifically the insurance here, 2 different times we looked into insurances here. The first time we just looked into it, got some information, and decided not to do it.
If you hear a scratching noise in the background, that's the dog.
She's licking her food dish clean. So the first time we looked into it, got some ideas, but didn't go through and buy anything. This second time, we looked into it and actually bought something. What we had learned is a number of the insurances here are either through a hospital or through a bank.
There's some agencies that offer it, but the primary is through the banks.
And it seems to me like I've seen an agency here that is probably like a worldwide agency. It has like a lion's head logo or something like that. But anyways, when we were at the hospital, they have a board like on the wall that says, these are the insurances we accept here. And I was just noticing a lot of those names, and so we checked into some of those, and we ended up buying an insurance here, and it's through La Paz Hospital. It's called Siempre Salud,
right.
And it's a major medical thing, but what we're trying to protect against is something bad happens and it costs $10,000, $20,000, $30,000, $40,000. That could ruin somebody financially or greatly set you back, and so we're trying to prevent that.
Yeah, and kind of how this all got started is early on when we lived here, I went to the hospital for a sickness, but it was a little tiny hospital, private, and it didn't cost us that much, like $300 out of pocket for a full night stay and all the medications. Well, when Brian got really sick and he went in for emergency and then stayed for 3 days and found out it was a kidney stone, it was a lot more.
And got a CAT scan and an X-ray.
And now we're paying $4,000 and $5,000 out of pocket. And it became something more concerning. We need to look into the reality of insurance at this point.
And so the insurance we got here through the hospital, if you go to the hospital, that's kind of the catch. And it's not that much different than a lot of U.S. insurance now. In the USA, you have to go to an approved doctor or get approved by your approved doctor to go to something kind of out of plan. Well, here it's kind of the same thing. to use the insurance, you have to go to La Paz Hospital and in the La Paz.
For the insurance we bought.
Yeah,
They're
for the
not
one
all
we
going to
bought.
be like this. Right.
Yeah, and hey, it paid off for us because we got it at the end of
last year,
2023.
Yep.
At the beginning of 2023, Debbie fell down and broke her wrist, and we had to get her to the hospital, and she had an emergency surgery. She had titanium plate and a number of screws put in her wrist to reset it.
And it had to be done the same day. And plus with all of my other issues, diabetes and such, they had a lot of tests that I had to have. So I had the emergency room, I had all the tests, I had the doctor's services and the surgery, 2 nights stay in the hospital, the insulin and the medications, and it was almost 70,000 quetzales, which is 10,000 US dollars. But now we have insurance. And so when we got that bill, we didn't have to pay 70,000.
Yeah, they covered almost half of what it was, and then afterwards you had follow-up of physical therapy, and they paid a portion of that too.
Yep.
So it was really good for us to have made that decision when we did and have it, or else, $10,000 wouldn't have ruined us financially, but it surely would have been a big setback for our plans and our lifestyle here, really, because...
Oh, and we were happily surprised because I was concerned because I had heard horror stories that some insurances, they won't pay for anything until you've had it for 8 months or a full year.
Well, we kind of knew that ahead of time because even with our limited Spanish and, nobody we talked to about the insurance, they didn't speak any English. But we kind of knew that we had immediate coverage on certain things. It was just kind of the finer details of things that we weren't 100% sure of. But man, we're completely happy with getting that and making that decision.
We feel that it's a good, because we pay what our cost for this coverage is about 120 US dollars. It's
for the two of us.
For the two of us, yeah, together. It's not each. And then we pay an additional little over $100 a month for the insurance, major medical with prescription in the US. And this covers a portion of your prescriptions or a discount on prescriptions if you go to the pharmacy in the hospital.
In La Paz.
In La Paz.
That's the Guatemalan insurance.
Yeah. And so speaking to that, maybe we should move right into pharmacies.
Okay.
And a lot of people will say, can't you get everything over the counter there? No, you can get a lot over the counter.
Right. I think I've heard things on both ways, but this is our actual experience. We've gone to the pharmacy looking for maybe a type of antibiotic or whatever, and those they will give to you without a prescription. The one thing that I'm really sure of is if you want some kind of narcotic type of drug, some pain reliever or something that is extremely strong, for those you need prescription.
Now we have received a couple of what I know in the United States would be considered, I don't know what they call them, Schedule 3. They have like a little bit of codeine or something. We've gotten that over the counter from the pharmacists themselves without going to the doctor first, because we've gone to the pharmacist and told them what's going on, and then they've made the decision what to give to us. And so that's been helpful as well. Yeah.
To me, it almost seems a little bit different than USA pharmacy, but I never tried this in the USA where you just walk to the pharmacy counter and say, hey, I have a pain here, blah, blah, blah. And they say, oh, you need this. Normally in the USA, we would have went to the doctor and I have a pain here. And then they would, here, right. Go get this, So it just seems to be a little, I don't know if it's that much different, but it seems to be a little different the way they do things here.
Well, the other nice thing in my case, I mentioned I'm a diabetic. If I've run out of my metformin or my insulin, I can get that here without going to the doctor first. But even that's pharmacy dependent. I went to one pharmacy that would not sell me my insulin pens, but I went to 2 other pharmacies and checked their prices, and they didn't have any problem just getting me what I needed. So it also can be pharmacy dependent as well.
Yeah.
But if I run out, I have the ability to get it here. But I will tell you, metformin if I had to buy out of pocket in the States, it's cheaper here. Same with the other. But with my prescription in the States, I get it for far less than I would pay here. So you have to look at what are you trying to get for yourself.
Yeah, well, some of that is because the insurance we have in the state, in the USA, covers
most of our
that stuff.
Yeah.
Where here, once again, the insurance we have here covers a portion of pharmacy costs if you go to the hospital's pharmacy. And unfortunately, at least here in Xela, their pharmacy is pretty small.
Right.
You're going to have a lot more things available if you go to one of the major pharmacies, Beatriz, Cruz Verde, Farmacia Económica,
or
things like
their
that.
municipal pharmacy
Yeah,
is called
ADEF.
And a lot of the things there are cheaper too.
They are there to support the public, you know, so they have a lot of medicines available. One thing I will say, and it's still about that pharmacy thing, in the USA, I was prescribed tamsulosin at one point for potential kidney stone issue. And also I was prescribed Synthyroid when a blood test came back that showed I was borderline with my thyroid numbers not being where the doctor wanted them. Both those things I had to get a prescription to get in the USA. Here, I just go to the pharmacy counter and ask for them, and their price on both of them were
pretty reasonable.
Pretty reasonable.
Yeah.
Once again, if you have a coverage in the USA that covers prescriptions or some amount of prescriptions, you're probably cheaper if you get them there, and then
but you have to be there to get it.
Or I mean, you're getting
people bring it down for me.
Yeah, it can be quite a workaround to make that thing work for you, to have somebody get your prescriptions in the USA and then somehow get them down here to you, unless you have the ability to be traveling back and forth pretty regularly.
Now, here's another point about medications in the pharmacies here. Some things that you get here are not available in the United States. They don't make the same thing, or they don't provide it. I had eye drops from our ophthalmologist that was a Mexican product that the United States didn't have, and wouldn't. I don't know if it wasn't approved there or what, but they worked great for me until I had my glaucoma surgery. So you have to be aware that just because it's not something you could get in the States doesn't mean it's not something that's going to be good for you. But the reverse is true also. You might not be able to find something you want here, and it's only available in the United States.
That even extends to medical care. The handful of times that we've had to go to see a doctor here or something, I've been really happy with the care that we've
had really great care
received. Now, you do hear some horror stories, but I've also heard horror stories about USA medical care too. But there are some things here that even the doctor will tell you, we do not have that ability to do that here. If you want that type of surgery, you have to go back to the US. Her glaucoma thing was one of them. That he was saying, we can't do that for you here right now.
He doesn't have the equipment, first of all, for that kind of surgery. For my glaucoma, he said, was number one. And the other thing, when I had my knees x-rayed, and he said, eventually I'm going to need knee replacements. He said, you're not going to get that done here. You're going to need to go to the States to get that done. And it's not a surgery necessarily that they just can't do, but because of what needs to be done, evidently, the cost would be prohibitive if you have any kind of coverage at all in the States. So,
yeah, I do vaguely remember that now. It's like if you have insurance in the USA, or we're creeping up on Medicare, Medicaid age. So
Medicare, yeah.
We will be in that
in the next 3 years.
Yeah, we'll be in that situation, coming up here. So once again, we'll be doing the same kind of thing.
So kind of to round this out for you, our cost, $25 a month in US dollars for this ambulance service and care that we get, $120 a month for our Guatemalan insurance, and about $120 a month for our US insurance. And to be clear, both of those are considered major medical. They don't cover every single thing, but our US insurance also includes prescriptions and low copay on our doctor when we go there.
And I consider us both still pretty healthy.
Reasonably healthy, yeah.
We're not in the best shape of our lives, and we're working on it. And we do have times where we go off the deep end, whether it's eating or lack of exercise or whatever. But we're relatively healthy.
We stay fairly active too, on a whole.
So we're getting what we feel is right for us, and as Debbie said, just under $250 a month covers us basically
For
every
just about
place we
everything.
go.
Yeah.
In our little world, Guatemala and USA, it's worldwide coverage. So, and I feel good about it.
So if you're thinking about moving here or visiting here, if you visit, definitely consider travel insurance, because most U.S. insurances, whether you have it or not, but most U.S. insurances are not going to be accepted here, at least not up front. Maybe you can reimburse, I don't know. But don't be afraid to come here if you're concerned about the health care available. They have great health care.
Let me bring one other thing up that we had talked about, but we haven't mentioned yet.
Okay.
When you're down here, there's sometimes when you go for medical treatment or whatever, and even if you had insurance or you're planning on paying, but you have credit cards, there's some places that you have to have cash. So
we learned that the hard way.
Yeah, it might be a smart thing to have a special savings or whatever that's just cash available for you for the what if, because when I had my kidney stones removed here, and I went to like a little surgery center. It wasn't in the hospital, it wasn't in the main hospital, but it was a small thing, 2 little operating rooms and some recovery rooms. And when it came time to check out there, they told us cash only. And it was
like $2,000.
Yeah, 15,000 quetzales, so $2,000. And we were kind of scrambling because we were thinking we'll just pay for it on our credit card. And when they said we don't accept credit card, now we're, trying to find a workaround, and we did. It took a little bit of negotiating with them and the doctor who performed the surgery, and we had called some friends and whatnot.
We checked with your mom. Can you send us some money? We checked with some friends. How much cash can we just borrow for a week or whatever? Ultimately, to have the money in time, I think I took out a cash advance on a credit card, and then we got money from your mom, and I paid off the cash advance. So we figured it out, but it would have been a lot simpler if we just had a backup savings for things like that.
Yeah.
Good point. Excellent point.
So I think that about wraps it up. We basically covered our experiences and what we've learned down here on this
the only
kind of topic.
I guess I'm going to repeat myself a little bit here, but we have both gone to just the doctor for something general. It all hasn't been a big operation or whatever. I've had shots or whatever we need to just talk to a doctor, and it's been very low cost, easy to pay out of pocket, and we've never felt like we didn't get proper care.
Well, and you know what? Speaking of that, even with the good insurance that we had in the USA, there were still co-pays involved,
right?
Almost the whole time. And what we have to pay to go to a doctor's visit here is equivalent to what we would have paid for a co-pay in the USA. So.
One last thing, and then we really will wrap it up and let you go. If you come down and move and get residency here, you have the ability to take your residency card called a DPI if it's in English, and you can go to a place called Centro de Salud for some things, blood work. We've gotten our tetanus shots there at no cost.
When COVID was still really going strong, that's where we went to get some
You did.
Oh. Went to get COVID test to see when I was sick to verify, yes, you had COVID. And they also gave us a little bit of medicines, pain relievers, vitamins, different things that they thought would help us in the recovery of COVID. And they gave that to us free of charge. So in general, Guatemala has a national healthcare system where you can go to the national hospital and get low or no cost treatment there. But we've always preferred to go to a private hospital, which a lot of times
They're
is
usually more upscale.
it's a
and
little more modern.
Yeah, that's the word.
Yeah.
Modern. With less wait time.
Yep, that's one thing we've seen in the national hospitals. A lot of times there's lines, and when you go to a private hospital, because you have to have cash to get in there or credit card ability to pay, there's little to no lines. You know, when I went to the emergency room, I was the first in line to get treated. So
yep, same for me. When I went in, I think I was the only one in there. I got in there at 11 o'clock. I was in surgery by 4:30, and that's after having all of my pre-surgery tests. So we prefer private hospital. Public's available if you don't have the money, and if you're willing to wait. We prefer to, have two insurances, and you have to decide what's right for you. But we've gotten great care. It's not been a problem, so come on down to Guatemala and spend some time and enjoy yourselves.
Yep, and I guess that's it. So
thanks for joining us again.
Yep, and we'll talk to you again soon.
Next time from Life in Guatemala. Bye-bye.